All right, cool. So if you guys need to interrupt me at any point, that's totally fine. Just raise your hand, I'll unmute you. Or just put it in the chat. So this is going to be a connecting with clinicals, basically a little overview of what a residency, because we're all applying for residencies all around the world, right? Or at least around the United States. And we want to know um, where it can take us, because these are essentially jobs and we want to know what we can do to move up. And so I'm going to start sharing my screen and then start recording. Oh, it is recording.
Yeah, I started the recording. Thanks, Johnny, for checking.
Thanks. Okay. Can you guys see my screen?
We can see it. Thank you.
Okay. All right. Let me move you guys over here. All right. No. No. Okay. We're gonna have to do it like this. Um, okay. So where can OB/GYN residency take me? So this is kind of broken up into three different parts. The first one is the direction that you can go with a residency that requires a fellowship. So this is going to be typically 3 years. And then there's going to be a few of them that don't require a fellowship. And then new and upcoming kind of positions and fellowships that you can do that are, it's kind of a mixed bag in new fields that are developing. So here's the one that we should all kind of be pretty familiar with. This is maternal fetal medicine. This is like high risk um, medicine. This is like pregnancies that are very complicated. The pay is really well because they're complicated cases. The lifestyle is really good because there's really no call, um, unless the hospital that you go to makes you do call, which would be weird. But they have high complexity cases and consultations, lots of ultrasounds, and like planning that goes on. Um, they do 3 years of residency, the average, and lots of academically. They're very like inclined to have academic consultations and like um, what's it called, publishing research, especially because these are oftentimes very complex cases. And something interesting about them is that they're really the only OB pathway that manages ICU level medical complexity during pregnancy, which is really interesting. Let's see. And then we've got reproductive endocrinology and infertility. So these guys, they make a good amount of money. I mean, all of these really make a good amount of money. I'm going to stop mentioning it. The office, lifestyle, a little bit of procedure-based things, and pretty much no call. They deal with like IVF, endocrine disorders, ART, which is assisted reproductive technology, 3 years training, and they kind of are in between the clinical medicine and laboratory embryology. And then gyn-onc, this is kind of how it sounds. You've got a lot of surgery involved here because this is more of the gyn side of OB/GYN. Um, you do have call, and you have you're mostly working inpatient here. Their lifestyle is pretty intense. It's pretty much like a surgeon's lifestyle. Um, they do right oncologic surgery, chemo care, and cancer management. Their training is 3 or 4 years, depending on where you apply. Um, and they're the something unique is that they're the only OB special subspecialists that can administer chemo and can do like radical oncology surgery, which is pretty epic. We've got Euroguide next. This one's very interesting. This one, I had the pleasure of working with some Euroguide specialists, and they do have a very interesting um, lifestyle, and their procedures are super unique and a lot of procedures that are by feel, which is very interesting. So you've got a lot of clinic, um, OR focused, right? So you're doing those procedures, and your call schedule is going to be more predictable typically. So they deal with incontinence, any types of prolapse, and reconstructive pelvic surgery. So 3 year training, and then uh, mostly they're in between urology and gynecology, and so they deal with both, and they work closely with both specialties. All right, so this is now um, specialties, or yeah, specialties that you can do after residency without a fellowship. So um, just a generalist, and I should just say there's no just. So OB/GYN generalists make a good amount of money and have a good lifestyle. Frequent call due to deliveries, but that would be in combination with others. So especially uh, if you work with partners and can kind of make a predictable call schedule, then the lifestyle is a lot better. Of course, mix of clinic and hospital work. This is typically the person or the attendings that you'll be working with in the hospital. And they have right prenatal care, deliveries, C-sections, routine gynecology, and guy surgeries. The training is 4 years, um, and of just 4 years of residency. Sorry, 4 years of residency, not a fellowship. And um, just all the great things about OB/GYN, right? You got care for both the patient and the fetus, and you get to attend deliveries, you get to do procedures, all the best stuff. Um, and then we've got the OB/GYN hospitalist or laborist. This is um, a shift work position that you would be like in a hospital, just pretty much attending deliveries. Um, so you would do triage for patients, inpatient obstetric management, deliveries. Um, it would just be residency, and you would have optional hospitalist training depending on the program. And this is all right, shift work, delivering 5 to 10 babies back to back, and you don't have to do clinic, which some people don't like clinic. Then we've got gynecology only. Um, so this is more predictable clinic schedule. This is like the opposite of the hospitalist. Um, you got OR days, but no overnight call. It's mostly they would do elective gyne surgery, pelvic pain, abnormal bleeding, right? So the training is just the residency, and it would pretty much you would be losing out on the OB, which is why you can kind of see that there's a little bit of a pay cut because unfortunately, most of the money in OB/GYN is in OB, which I don't know if that's a topic we want to discuss today, but anyways, gynecology, you would be um, creating almost a more predictable schedule because now that the babies that choose when they want to be delivered um, are out of the picture, then you can just make everything on a schedule. And then we've got outpatient women's health and preventative care. This is a cool one that I didn't know was like a thing that we could apply for and do. Uh, it's clinic hours, minimal call, great work-life balance. You get to do well women exams. You get to prescribe contraception, menopause care, screening, pretty much a lot of this clinic work, which is some people like clinic work. OB-GYN residency is all you need, and something unique, right? You get to develop decades-long primary care type style relationships with patients, um, and through multiple life stages, which is, I think, the most interesting part. Right, you get to work with people who are pre and post menopause, and um, you get to have a more uh, balanced work life balance. And then we've got academic general OB-GYN. So this is people who are interested in research. So you've got clinic, teaching, research, um, predictable clinic schedules. Uh, you get to pretty much do what a generalist does, with on top of that research and education. The training, sometimes they add to the residency, which is just some research on top of that, which a lot of programs will allow you to have a lot of research experience. And right, this is the kind of the bleeding edge of OB-GYN, and you get to directly shape the future of the specialty, and your influence goes to beyond just your own patients. It goes to other OB-GYNs. And here's now some upcoming um, and new uh, subspecialties. This is MIGS, which is minimally invasive gynecologic surgery. Uh, I had the pleasure of working with a MIGS specialist in Danbury Hospital in Connecticut. Um, it's a fantastic specialty. You get to use the Da Vinci robot, which is awesome. Um, and let's see, so they get the same typical pay as a generalist, sometimes higher. Um, you get clinic and the OR, less deliveries, but more surgery. You get to use laparoscopic, right? You get to use the laparoscopic robotic procedures. The training is 1 or 2 additional years on top of the residency. So that's also changing. So it's going to be 3 years soon. And this is another one of those specialties where sometimes you have to take a pay cut because you're losing the OB side, a little bit of the OB side, unfortunately. Um, Plus an extra year that they're adding on now, which is now 3 years of training. However, you do get to have some very interesting cases, um, cases that a lot of generalists would reject, and so you get to learn and become the specialist in your field. And you have minimum, hopefully minimum open cases, and you get to do everything laparoscopically, which greatly improves the healing time and process for patients. And then you've got pediatric, adolescent gynecology, um, the clinic based, so you don't have that much call. Pediatric hospital consults is what you would be picking up. Let's see. Um, you would pretty much be doing adolescent reproductive issues, congenital anomalies. Um, the training is a fellowship, or specialized training after residency, which would be hospital specific. Um, and here you get to manage, congenital reproductive anomalies that we learned about, which is interesting, right? You get to use that knowledge that we got. And then here's some honorable mentions. Um, so we've got menopause medicine, public health track, industry. You can go into medical devices, right? The development of things like the sling and things like that had people that had, OB-GYN specialists that were necessary to like consult on these devices. Hospital admin, research focused, academic, um, and yeah. So, does anyone have any questions? If you raise your hand, I will unmute you.
I think Marina Del Toro has a question. Her hand's been raised for a while.
Yes, uh, um, I can give you the ability to unmute, but I can't unmute you directly, Marina.
Maybe that was an accident. We'll.
Yeah, anybody
Oh,
else? Yeah.
no problem. Totally fine. Okay, well, thank you so much for Johnny for that presentation. You actually mentioned a couple
Yeah.
of subspecialties that I was not aware of that existed on their own, for instance. Yeah, so that was
Mhm.
super informative. I'm gonna go ahead and stop the recording. Thank you everyone for attending today. I do really appreciate it.